Hello to all. So in this lecture I will try to outline the differences between nephrotic and nephrotic syndrome, as I have covered both these topics. So I would like to briefly summarize the differences between the two, as it is a very important topic. So let's start. So in terms of the pathogenesis, we know that the nephritic syndrome, it is immune complex mediated, and there is immune complex deposition which is causing the complement activation, and because of that there is inflammation in the glomeruli, and that inflammation causes damage to the glomeruli, and the glomerular filtration barrier, it becomes permeable to the proteins and RBCs, while nephrotic syndrome, it is non-inflammatory. So majority causes are idiopathic, but immune dysfunction is also seen, which causes the damage to the podocytes. So the important difference in the pathogenesis is that there is inflammation in nephritic syndrome, and in nephrotic it is non-inflammatory. So next, the causes of both are different. The important causes of nephritic are post-streptococcal glomerulonephritis, then lupus nephritis, IgA nephropathy. And in nephrotic syndrome, again, variety of causes are there, but the important ones are minimal change disease, focal segmental glomerular sclerosis, then diabetic nephropathy, amyloidosis. These two are among the important causes of secondary glomerulopathies causing the nephrotic syndrome. Thirdly, if we see clinically, proteinuria is very marked in case of nephrotic syndrome. So it is called a nephrotic range proteinuria, which is more than 3.5 grams per day, while in nephritic, the proteinuria is less than 1 gram per day. Hematuria is marked in case of nephritic syndrome, and even we get a cola colored urine, or sometimes we also call it smoky urine because of hematuria. RBCs are coming in blood, and those RBCs are also dysmorphic. And in nephrotic, generally hematuria is not seen, but can be seen if the disease is advanced. Then hypertension, it is also seen commonly in nephritic syndrome, and it is not seen in nephrotic syndrome. Edema, it is mild in case of nephritic, while it is marked in case of nephrotic syndrome, because there is a heavy loss of proteins, and that causes the edema, which can be even generalized. Next, in the blood findings, hypoalbanemia, that is decreased in the albumin concentration in the blood, it is marked in case of nephrotic, because the protein loss is more in case of nephrotic syndrome in the urine. So in the blood, albumin levels are decreased to less than 3 grams per deciliter, while hyperlipidemia is also seen in case of nephrotic syndrome because of the abnormal transport of the lipids, while this lipid level are normal in case of nephritic syndrome. So hyperlipidemia and hypoalbuminemia, they are very much marked in case of nephrotic syndrome. Then there is the urine examination. So in the urine examination, nephrotic range proteinuria is seen in case of nephrotic syndrome, which is more than 3.5 gram per day of urine, per day of protein in the urine, while in nephritic syndrome it will be less than 1 gram per day. Then hematuria is marked in case of nephritic, while it can be seen or cannot be seen. Then RBC cast, since RBCs are seen in the nephritic syndrome, so RBC cast, they are also commonly seen in nephritic syndrome, while they are absent in nephrotic. Then there is hyperlipidemia and also lipiduria in case of nephrotic syndrome. So the lipids, they are filtered in the urine. So lipiduria and lipid cast and oval fat bodies, they are seen in case of nephrotic, while absent in case of nephritic syndrome. And regarding these, the formation of these things, I have told in the lecture of the nephrotic syndrome, so you can refer to that. Now dysmorphic RBCs, they will be seen in case of nephrotic syndrome, while they are absent in case of they will be seen in nephritic syndrome and absent in the case of nephrotic.